Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomas & Swanson & Zahn Attorneys at Law.
Hello, my name is Sarah Swanson and I'm here today with my partner Roger Zahn. We are attorneys at the law firm Thomas & Swanson & Zahn in Park Rapids. We're here today on the Wellness for Life series to explain a bit about the elderly services that we offer at our law firm. Perhaps you've caught earlier segments where we've explained in greater detail about our geriatric care management services. If you haven't caught those, we will have them available for you to view on our website. But just a brief explanation of geriatric care management is that a geriatric care manager is a professional social worker or a nurse who is trained as a geriatric care manager. At our firm, we employ Laurel Hade, and we like to call her our professional adopted daughter. She works in conjunction with us while we work on the legal issues, Laurel can take care of the geriatric care management issues. Roger, can you explain a bit more about the legal services that we offer at our firm?
Sure, thanks, Sarah. If you saw our previous segments, we focused on why does a law firm need a geriatric care manager. I'm going to come at it a little bit from a different angle, is why does a geriatric care manager need a law firm? Our firm is a member of an association of law firms around the country employing geriatric care managers. That association is called the Life Care Planning Law Firms Association, and it contains about 80 member law firms around the country. There is always a connection between care issues and legal issues when geriatric care management is involved. In housing changes, in qualifying for benefits such as veterans benefits or medical assistance, legal issues are equally important and intricately tied together with the geriatric care management issues. We want to make sure when you come into our office that you have your basic estate planning documents in shape, or if they need to be changed in order to deal with your current circumstances, that changes are made. Your basic estate planning documents are your will, perhaps a trust, a power of attorney, and a health care directive. That's the basic estate planning package. And it can be different and is different for each and every client.
Roger, could you give an example of where the legal services were closely connected with the geriatric care management services through our firm?
Sure, Sarah. I can think of a case of an elderly client living in the Park Rapids area who was struggling with being able to stay home any longer and was on the verge of moving into an assisted living facility. Her child that was her caregiver lived on the East Coast. We made arrangements, first of all, for a power of attorney so that the son could manage financial affairs for her. And then we arranged for Laurel to visit at her home every 2 weeks and give her son a report. Adjustments have been made to her living arrangements, and because of Laurel being able to give her son the reports and improve the way her home life is operating for her, she's still living in her home today. And so with that, we believe actually, as in many of our geriatric care management cases, the services are less expensive than actually having to sooner move into an assisted living facility or a nursing home and face those high costs. So the experience of members of our Life Care Planning Law Firms Association law firm organization is that many times, maybe even most cases, the costs are lower if you use geriatric care management to make it possible for the elderly person to stay at home safely much longer.
So if you have any questions about the services offered by our firm, we would be happy to schedule a consultation with you wherever it's most convenient for you, at our office, in your community, or even in your own home. Thanks.
Thanks.
Coming up on Wellness for Life.
Hello, I'm Matthew Kaufenberg, physical therapist and owner of Back in Motion Physical Therapy. I've talked a lot in past episodes, I've talked a lot about low back pain, and with good reason. Low back pain is by far the most common injury that I will see in my clinic. You know, most people, some 8 out of 10 people will probably have some sort of back pain in their life, and so we see it a lot. So that's why I talk about it a lot. The other thing with back pain is that there are so many different reasons why we get back pain. In other words, there's many different sources of back pain. It could be a muscle strain. It could be a disc problem. It could be a facet joint problem. It could be the sacrum that's causing the problem. There are just so many different reasons why someone could have back pain, which is why it's really important that you do seek out the advice of a medical professional when you have back pain to really help you determine where that pain is coming from. So today we're going to talk about another source of back pain that's fairly common. What I would call it is that it's pelvic malalignment due to muscle imbalances. So what does that mean? So pelvic malalignment. So the pelvis is this large bone that, a lot of people will call it their hip, but it's this bone that you feel here. It's this large bone. That's called your pelvis. That pelvis can become malaligned, or it can be in the wrong position. Typically when it's in the wrong position, it is due to muscular imbalances. What that means is the muscles have either gotten too short or too tight, or the muscles have gotten a little too weak, and there's some sort of imbalance which causes the pelvic to become malaligned. Usually the pelvis will either become malaligned in what we call an anterior tilt, or it will become malaligned in what we call a posterior tilt. So an anterior tilt, if you look at someone from the side, the anterior tilt is when the pelvis is actually rotated forward. So it's shifted forward. A posterior tilt is when the pelvis is actually shifted backwards or posterior. So if we look at normal alignment on this particular drawing, normally the spine has 3 curves to it. So at the neck we have this inward curve that then changes in what we call the thoracic spine, or the spine between your shoulder blade. It then starts to curve outward. And then when we get back into the low back, it actually starts to curve inward again. That's very normal when you're looking at someone from the side. That's what you want. And the reason we want that is because this actually acts as a spring then, and it works really well as a shock absorber. Problems, however, can come into play when some of the muscles in the area, so we've got the stomach that attaches, from the spine into the front of the pelvis. We've got low back muscles that attach on the back side of the pelvis. We've got what are called the hip flexors, which sit right here. These are our hip flexor muscles. Those muscles can become problematic, or the hamstring muscles can become problematic. So remember, we have anterior tilt and we have posterior tilt. So let's talk about the posterior tilt. In someone who has posterior tilt, they're going to have tight hamstrings and they're going to have weak low back muscles. So anatomically, if that hamstring gets tight, it's going to pull on that pelvis and cause the pelvis to tilt this direction. So this blue dotted line is suggesting where the pelvis should be. When the hamstring gets tight, and in combination with a weak low back, that pelvis will tilt. What that then does is flatten out our spine. We no longer have this normal curve of the low back, but we have a very flattened low back, which then increases the stress placed upon our disc. In the second scenario, we have that anterior tilt. So the anterior tilt is going to be caused by tight hip flexors. So our hip flexors are going to be tight, and we're going to have a weak stomach. When that occurs, the pelvis again will now tilt forward or anteriorly. Again, look at the blue dotted line. That's where we want the pelvis to be. This is the normal curve. When the pelvis is tilted forward, that curve becomes really exaggerated. When that curve becomes really exaggerated, it puts a significant amount of pressure on the joints of the spine, and we can end up with back pain. So the treatment for all of this is to realign the muscular imbalances, either stretch the hip flexors or stretch the hamstrings, or strengthen your stomach or strengthen your low back. And that's why you come and see me, because I can teach you a variety of exercises to help you do that. Thank you very much. If you have any questions, don't hesitate to call me at 218-346-2464.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomas & Swanson & Zahn Attorneys at Law.